Hi, my name is Mary Catherine Elledge, and I am a registered nurse in North Carolina. I currently work in a pediatric intensive care unit. I have recently taken part in a collegiate debate regarding S1619, the Vaccine Awareness Campaign to Champion Immunization and Enhance Safety Act of 2019. The best argument I have found for this topic is that it will help spread important information that is based off of facts and evidence in order to rid the population of false information that's out there about vaccines. Therefore, this will increase the rate of individuals who receive these vaccines. The best argument I have found against this topic is that not having the same vaccine compliance in every state may potentially be a barrier to the success of this bill. Due to this, launching a national vaccine awareness campaign with the goal of increasing compliance may already be doomed in a waste of resources. If there are pieces of legislation that are constantly contradicting one another, I think it would be difficult to accomplish anything. This bill is currently at the beginning stages of the legislation process. It was introduced on May 22nd, 2019 to committees to debate before sending it to the Senate and then to the House. I am for this piece of legislation for 3 reasons. First, this topic impacts the nursing field because of the type of diseases we will see and be exposed to if people do not get their recommended vaccines. Vaccines have increased the average life expectancy by drastically contributing to the reduction of infectious diseases present in today's society. Part of our job as nurses is to advocate for our patients and our communities, and this bill would positively help our health promotion efforts in getting everyone vaccinated. Second, this bill will help combat misinformed people who are against vaccines for reasons that have no real evidence to support them. Those that are opposed to vaccinations for fear of their children getting autism, for example, are not validated. The more people hear that these things are simply not true and how these infectious diseases are preventable through vaccines, the more compliant our society as a whole will be in receiving these vaccinations. Third, our country's citizens should have all of the correct information in front of them so everyone can make an informed decision about vaccines. It is important to educate the public on what exactly these vaccines are protecting us from, what these diseases look like, what they can lead to, and how contagious they are. Due to the fact that there are not many people who are infected with several of these preventable diseases, it is not at the forefront of our minds. I think it is our obligation as healthcare workers and for our government to make this information more relevant to the public. I think this bill should move forward to the Senate by being passed by the reviewing committees. This is something that should be done sooner than later because the number of individuals who are not receiving vaccines is increasing when compared to numbers 10 years ago. This is a bill that could potentially help protect our society from reintroducing dangerous infectious diseases to the population. Thank you.